In congenital heart disease, how to treat the child if it is asymptomatic? If we have to wait till the symptoms appear, then by what chance it will make no worse when symptoms appear?
Okay. Here we are. In congenital heart disease, how to treat the child if it is asymptomatic? And if we have to wait till symptoms appear, then by what chance it will make no worse the symptom appear? How long the LM potency can be repeated in acute exacerbation of chronic disease? Am I right this? Nandini, you can hear me right, okay?
Yes, sir.
So we have been treating in our clinic a few congenital heart disease and many congenital pathologies in general. Very often in these type of cases, there are a few things that you want to give importance to. The first thing that I give importance to, very important, is especially history of mother during pregnancy. So this is a very important area for me. History of mother during pregnancy. The pregnancy history can give you a lot of details, and especially if you can see certain symptoms of the mother during pregnancy and the child. For example, mother had a lot of craving for sour and the child also had a lot of craving for sour. So that becomes a very, very important kind of symptom. So this is one. Second is congenital heart disease very often initially may not have so many symptoms. So you would want to look at the general symptoms, the craving, aversion, the thermals, chilly, hot, the sweat, which area the sweat is more, the past history of illnesses, how the patients react to hunger, which position the mother would like to lie on the left side, on the right side, on the abdomen, on the back. The child wants to lie down on the abdomen or knee chest position or which position. The perspiration, does it stain, does it smell? How was the periods previously for the mother? So many different things. So this is what I would give a lot of importance to, generals and general mental. And your question was about LM potency. LM potency often, I generally start with LM1 and I start with giving for probably for about 3 to 7 days, depending on the case. So I would give LM1 for once a day for about 3 days or once a day for 7 days, depending on the intensity of the problems. And then follow up every month. In many congenital heart diseases with symptoms, one of the remedies that I have used as an acute remedy is the remedy laurocerasis. So it's a very interesting remedy that you want to have a look at. The remedy laurocerasis belonging to the Rosaceae family. And it's a very interesting symptom. Spasmodic tickling cough in cardiac patients are very often improved with this. And this is one of the important remedies even for asphyxia neonatorum. So when the congenital heart diseases patients may go into a kind of emergency, you can see very beautifully laurocerasis is one of the pathological remedies for this kind of case. And it has helped in few cases, although the scope is limited for homeopathy, but still we can at least try to reduce the suffering for the patient. I hope I was able to answer your question.
Yes, thank you so much for explaining in patience, sir. Thank you.
Thank you.
Hello and namaste from Mumbai. I'm very, very excited to share with you that this December we are launching the advanced course on classical homeopathy. So all the homeopaths out there, students, interns, early practitioners, students anywhere, this is the thing you need to join. It's a weekend course, online course. You can sit at home and learn. In today's times, the world has been online. We are going to be talking about 100 polycrest remedies, also rare remedies, organon, repertorisation techniques, advanced level of case taking. Also, we'll also talk about how to use mother tinctures, organ remedies, biochemics. It's going to be one of its kind. Homeopaths across the world are going to be teaching also in this. And I'm working on the content of it very, very closely with the best minds in homeopathy. So I really, really want every single one of you to join us, be a revolution in this field. I'm also going to give a lot of homework to all of you. So be ready for a lot of training sessions with me. Also, there is an early bird offer. So if you register earlier, you will get it at a major discounted rate. And if you already attended my last course, you'll also in this early bird offer, you'll also get the last course, that is the 6-month classical homeopathy course, as a guest access. We are going to increase it for 6 months. So you'll also attend the last course plus this course. So it's going to be close to about 200 hours of classical homeopathy at your fingertips for the next 7-8 months. It's going to be one of its kind. So if you want to be a genuinely good homeopath and a clinician, this 200 hours will take you to the next level. So forget everything else. Forget the Netflix, forget the Amazon Prime, forget the movies, forget the stories. Classical homeopathy at its best. Just email on the below email ID, register, be a part of revolution. Every single one of you listening, hand on heart, join us.